Myself Dr. Nidhi Shukla, Assistant Professor, Department of Paramedical Sciences, Rama University, Kanpur. So my today topic is whiplash injury. So the whiplash injury is, first one is the whip and lash. Whiplash injury is common in the sports, and the number of athletes who is performing the power sports like boxing, like martial arts and the karate. The whiplash injury is the cervical injury, and the cervical ligament and the cervical complex will be tear in that type of injury. So the whiplash injury is the most common type of injury, like a road traffic accident, where the cervical spine and the ligament will be accelerate and the decelerate at the time of injury, and the ligament and the cervical structure will be tear after that injury. So it is the most common injury in the road traffic accident, in the rear impact, and also the most common sports. So firstly, I am discussing about the definition of whiplash injury. So the whiplash injury is a type of cervical injury where the cervical ligament and the cervical structure will be tear, and also the fracture of the cervical spine. It is the type of injury like cervical structure will be tear, and the mechanism of the injury is the sudden acceleration and deceleration of the cervical spine. Like the mode of injury, or we call the mechanism of injury, where the cervical is going the sudden acceleration and sudden the deceleration, where the cervical spine going in the hyper extension and sudden going the hyperflexion. At that time, the cervical spine will be tear and the fracture. So it is depending upon the where the what is the impaction will be occurred at the time of injury. So we are dividing the whiplash injury in the grading wise. That is called as the whiplash associated disorder. That is short form is the WAD. It is dividing in the 0 to 4 type: WAD 0, WAD 1, WAD 2, WAD 3, and the WAD 4. So in the WAD, that is the whiplash associated disorder 0, in that classification, the cervical spine will be sudden accelerate, and the small kind of injury will be occurred. At that time, in this classification, no physical sign will be appear. Only patient will be feeling the pain, and also, so no physical sign in the whiplash associated disorder 0. In the whiplash associated disorder 1, we will be classified the whiplash injury. In that time, the physical sign will be appear at the time of injury, and the patient symptom will be less comparative to WAD 1. In the WAD 2, the sudden musculoskeletal changes will be occurred. In the WAD 2, musculoskeletal changes will be occurred at the cervical spine, where the ligament will be tear. The grade 1 and grade 2, grade 3 injury will be occurred, like the ligament and the tendon will be tear. So the musculoskeletal sign will be present. In the WAD 3, the neurological sign will be appear, and the patient will be faint, and sudden dizziness and the tingling sensation will be occurred at the side of the cervical spine. So we will classify the WAD whiplash associated disorder 3 in the presenting the neurological sign. In the WAD 4, there is the fracture and dislocation will be occurred. So WAD 4, there is the fracture and dislocation will be occurred, and the patient will be faint and not moving the cervical spine. So the whiplash associated disorder, we will be classify the WAD 0 to 4. In the WAD classification, we will dividing the sign and symptoms, and we will be classify the symptoms according to the symptom of the grading wise. So sudden symptoms, sign and symptoms will be occurred. Sudden sign and symptoms like patient feeling sudden blurring sign, and the pain in the neck, radiating pain will be occurred in the cervical to shoulder and going in the wrist also. Sudden patient feeling no range of motion will be lost, swelling will be occurred, inflammatory sign will be present at the site of the cervical spine. When the ligament will be tear, so patient not moving the head properly, and these type of symptoms will be occurred in the sudden appearing sign. At the last and the late sign will be occur like a dizziness, fainting, blurring sign, ringing in the ear. That type of sign and symptoms will be occur in the late symptoms. So we will be divided the sign and symptoms according to the whiplash associated disorder. After that, we will be classify according to the sign and symptoms. We will be diagnose the whiplash associated injury or whiplash injury. So in the diagnostic, we will be examination like a physical examination and the diagnostic examination. In the physical examination, we will be palpating at the site of the cervical spine. We feel where the tenderness will be present and where the swelling will be present. Patient range of motion will be we will be measured like a range of motion will be will measure with the goniometer. MMT test at the cervical muscles, cervical ligament, and after that we will be clearly physical examination. We will diagnose in the imaging examination like a X-ray, MRI, CT scan. The imaging examination, we will conducted the X-ray, MRI and the CT scan. After that, we will doing the some special test for the whiplash injury. Special test, in the special test we will present it in the special test we will be doing the foraminal compression test. In this test, the patient is in the sitting position, the therapist behind the patient. Then we will doing in the 3 phases in the foraminal compression test. In the stage 1, the cervical will be moving in the side flexion. Then in the in the phase 1, if patient feeling the pain at the site of the injury, so we will clearing the special test in the positive sign. In the second stage, we will just side flexion, then if in the stage 2nd, the side flexion will be occur. So if the patient feeling the pain at the site of the injury, so we will finding the positive test. In the stage 3, just rotate the cervical spine at the side. If the patient feel sudden numbness at the site of the shoulder, same side of the shoulder, so we will consider the foraminal compression test is positive. If the numbness, tingling or the pain will be not occurred at the site of the cervical spine or not radiating at the site of the shoulder, same side of the shoulder, so the test is negative. Okay. The next test we will doing the compression and distraction test. In the compression and distraction test, the patient is in the sitting position, the therapist in the back side of the patient. Then compress the cervical spine at the side. We will making the fist this side and just compress the cervical spine. If the patient feel sudden radiating sign at the site of the shoulder, same side of the shoulder, so the test is positive. When we will distract the cervical spine, So patient feel relaxed and not complaining at the site, not complaining any numbness. So the test is positive. If no pain, no tingling sensation, no radiating sign will be present, so the test is negative. Okay. Next, 1, 2, ULTT test. Third test is ULTT. In the ULTT test is the upper limb tension test. Upper limb tension test, we will just testing the nerve test, nerve compression test. In that the median ulnar and the radial nerve will be tested. Patient in the side supine position, therapist in the side of the patient. Then we will doing the just nerve stretching. If patient complaining any type of numbness and tingling sensation, so the test is positive. So we will doing the 3 special tests in the whiplash injury. First one is the foraminal compression test, second is the compression and distraction test, and the third one is the ULTT test. So if the test is positive, so we will just doing the provisional diagnosis that like a whiplash injury question mark. Okay. Next, this is the diagnosis. There is the physical examination, imaginary examination, and the special test we are doing. Last one is the we are just doing the management of the whiplash injury. So management. We are just doing the physical. If the patient is in the WAD disorder, if the patient is in the 3 and the 4 grading classification, so we are not touch the patient, just going to the emergency and admit the patient. If the WAD disorder 1, 2 or 0, we are doing the physical therapy like X sum of the McKenzie exercise, mobilize, depending upon the patient condition. In the first phase, we are just doing the price protocol. After that, just we are providing the some of the soft cervical collar, so not moving the head or cervical spine. Next one, we are just in the phase 2. If the patient is in the phase 1, we are using some kind of modalities that decreasing the pain like ultrasound therapy and the hot fermentation we are doing. So patient pain is subside. If the patient pain is subside, and next phase, our goal is increasing the range of motion and increasing the strength of the patient. So we are doing some kind of exercise like a range of motion exercise, is including the passive range of motion exercise and the active range of motion exercise. Okay, so the cervical spine range of motion exercise will be doing like passive and active. Next one, we are doing some kind of strengthening exercise of the cervical spine, like the strengthening exercise MET we are doing. Okay, and next, stretching exercise. In the stretching exercise, we are stretch the related some kind of muscle. We are stretch and just relax the patient. MFR is the myofascial release technique for releasing the some kind of stiff muscle releasing, and so patient feel very soothingness. And in the phase 2, we are doing this type of exercise and kind of management we are done. If the patient will feel increasing the range of motion and strength of the muscle, so we are going to the phase 3. In the phase 3, what we are doing? In the phase 3, these exercise will be continued, and just kind of some kind of preventive technique we are doing like a K-taping, including the cervical muscle. Next, and the ligament also. Dry needling for releasing the some kind of trigger point, so patient feel decreased pain at the site of injury. Okay, and just MET technique we are, and also the PRT, that is the positional release technique, kind of applied. And after that, phase 4. In the phase 4 is the sports specific rehabilitation we are doing. In the sports specific rehabilitation, we are doing the plyometric agility training, in plyometric training for the upper limb. So patient feels like if the volleyball and the throwers, so patient feel easy. Just remember point is the WAD 3 and 4, we are not touching the patient and just admitted in the emergency. Okay, so this is the whiplash injury, the summary of the whiplash injury. Whiplash injury is the cervical spinal injury, and the cervical injury, this is the most common injury in the some kind of sports like boxing, like a karate, like a martial art. The whiplash injury will be occurred at the road traffic accident. There is the sudden acceleration and deceleration of the cervical spine, and if the rear impact will be occurred, so the cervical ligament will be tear, and also the fracture will be occurred. And there is the some kind of sign symptoms. We will be dividing the sign symptom in the whiplash associated disorder. So we will make the simply diagnosis, which classification will be done. So the sign symptom is the early symptoms and the late symptoms. In the early symptoms, there is the some kind of inflammatory sign will be present. Patient feel dizziness, patient feel loss of range of motion, and sudden pain at the site of injury. In the late symptom, blurred vision, tingling sensation, there is the dizziness will be present, fainting, and also the patient feeling the vomiting. Okay, ringing in the ear also. After that, we will add associated with the sign and symptoms, we will divide the whiplash associated disorder. There is the whiplash associated disorder is 0 to 4. There is dividing in the 0 to 4, where the classification will be occurred of the whiplash injury. After that, we will making the diagnosis like physical examination or the physical assessment, imaginary assessment, and the special test. Physical examination, we will doing the subjective and objective examination, and in the imaginary examination, we will doing the X-ray, MRI, and the CT scan. After that, we will doing the special test, like a 3 special test of this whiplash injury is the foraminal compression test, compression distraction test, and the ULTT test. After that, we will making the provisional diagnosis. We will making the one of the rehabilitation protocol or the management of the whiplash injury in the phases wise. In the phase 1, PRICE protocol we are used, and some kind of pain relieving modalities. Second phase, increasing for the strength of the muscles and releasing the muscle, we are using the MET technique, MFR, strengthening, stretching protocol. In the phase 3, we are using the some kind of prevention measure like a K-taping, dry needling, and the PRT. And the phase 4, we are doing the sports specific rehabilitation. In the sports specific rehabilitation, according to the sports, we are just dividing the sports like a cervical plyometric test and the plyometric reason, and also kind of continue all the exercises. So this is all over the whiplash injury. Thank you so much.